visible.
I'm visible?
Yeah, ma'am.
Okay, fine.
Ritika, let us know when you're live, okay?
So we are live.
Sir, we can start after 10 seconds, sir.
Yeah.
We are live. Yes, sir, we can go.
So first you'll go with the video, right? Yeah.
Yes, sir, we can go ahead, sir.
So good evening and a warm welcome to this Thyroid Awareness Initiative by the Indian Thyroid Society. I am Dr. Shyam Sundar, consultant endocrinologist at Bangalore. And today, among the panelists, we have a mix of, the mix of three experienced endocrinologists, right from fresher to a well-experienced endocrinologist. So let me introduce them to you. At the first, I would like to welcome Dr. Maithili Ayagari ma'am. She is a senior consultant endocrinologist at Vishakhapatnam, and she was also our professor at Andhra Medical College. So I welcome you, ma'am.
Thank you, Shyam. Thank you.
Next, I would like to welcome Dr. Prem Narayanan. I don't think he needs any introduction for all the social media enthusiasts. So, sir is a consultant endocrinologist and he's a director at Ahalya Diabetes Hospital, Palakkad. And he is very active on the Insta and YouTube as well. So, I welcome you, sir.
Thank you so much, Shyam, and also Indian Thyroid Society.
Yeah, thank you. So next I welcome Dr. Vishwanath S, who is my colleague and contemporary in DM endocrinology. And currently he is a consultant endocrinologist at Sarji Super Speciality Hospital, Shimoga, Karnataka. I welcome you, Vishwanath.
Thank you, Dr. Shyam, for that introduction.
Yeah. So without wasting much time, so we will go into our topic. And this is very common and a relevant topic in this current era. So most of the patients now they are getting a health check done. Either it is because of the increased awareness or it is because of their corporate package or the health insurance package. And they are coming with, some abnormal thyroid function tests being seen in those reports, and from there they are panicky and they are worried about their results. And also because of our lifestyles, there is increasing prevalence of obesity and infertility and PCOS. So today we combine these three topics. So thyroid, obesity, and PCOS. Are they interlinked together, and how do they interact with each other is what we are going to understand today. So at the first, I would like to ask Dr. Prem, sir, what is obesity and what are the hormones linked with obesity? Can you just enlighten on this?
Definitely. Thank you, Dr. Shyam, for the question. Yes, obesity, we know the present times, it is one of the commonest problem that we encounter. And another the thing is that most of the people who are having obesity usually do not consider obesity as a disease or a disorder. They take it like something that is running in the family. That means genetics, or my father is having overweight, or my mother is having overweight, so that's why I'm like this. So they take it like that. But the point to be noted is that yes, obesity is also a disease or a disorder, and it can further lead on to many other problems or complications. How we or what in simple terms, if you ask me, obesity, yes, it is having an excess body weight. But to be specific, yes, body weight means yes, the muscle builders have also have excess weight sometimes, isn't it? Big muscles sometimes we see. But in obesity, it is an excess amount of body fat. So that is why we how we term a person as having obesity. The common method that we assess an overweight or an excess weight in a person. First, yes, of course, measuring the body weight. Usually what we say is that the ideal body weight means yes, you measure your height in centimeters and subtract 100 from it. That is an ideal body weight supposed to be. But again, there are other indices like the body mass index, where we measure the height and the weight, and weight in kilograms divided by height in meters square. We get the body mass index. For Asians and especially Indians, the normal BMI is between 18.5 to 22.9. And above that, it is overweight. About 23 and above is considered to be overweight, and up to 24.9. And 25 or above, we consider as obese for Indians. This might also be, these numbers might be astonishing for many people who are listening to us. Because yes, when we see the Western data, it is from 18.5 to 24.9, they consider it as normal. But for Asians or Indians, it is entirely different, because we see a lot of chronic problems, chronic diseases, lifestyle disorders in our country. And for that, the excess fat is a very important factor. So again, BMI alone does not suffice. That's why we have to measure the waist circumference, because there is a concept called the thin fat Indian concept. Doctors always talk about it in many of the conferences always. And public also need to know, because many times we see in our OPD that the body weight is fine, or maybe in the ideal range also. The BMI is within the normal range. Still, we might have to consider that person as having excess weight after measuring the waist circumference. So that is the waist circumference and the waist hip ratio. There is abdominal obesity. It's very important, because the abdominal fat is one of the major contributors for the lifestyle diseases that we see, the diabetes, the hypertension, the dyslipidemia, and also leading on to the cardiorenal or the cardiovascular complications. So yes, we have to definitely measure that. Then there is another measurement, that is measuring the body fat percentage. Body fat percentage can be measured. Right now, there are a lot many in clinic measurements can be done by body fat analyzers. We also have one body fat analyzer, and within 3 minutes you will get the fat distribution to a good extent, the skeletal mass and also the fat distribution in a person. And based on that, also we can classify a person as having excess weight or not. And the ideal one will be the DEXA, or the like that. It's like an X-ray like machine, where you can get a very accurate distribution of fat in the body. So these are the various ways, just a nutshell about the obesity and the indices, or how to measure the body fat in a person. And based on that, you can classify whether the person is having an excess weight or not. And coming to the hormones related to the obesity, yes, whenever, we all see in our OPD that obesity means the first hormone that will be checked by any person or any patient will be the thyroid hormones, isn't it? But one thing that, because many people say, yes, my TSH is so and so. So maybe it will be slightly above the normal. Say TSH is 7. I'm having a BMI of 32. It is because of this TSH. So very important thing that has to be kept in mind to common to the public is that the thyroid hormone disorder, especially hypothyroidism, has been the one that has been linked to the weight gain. But the weight gain that happens with the thyroid disorder or the hypothyroidism is that it is mainly the edema or the retention of the fluid in the body, mostly that happens. And that's why mostly the distribution will be in the face and even the legs. So, the books say that the increase in the body weight will not usually cross more than 5% from the previous body weight in person with the hypothyroidism. So, if it is much more than that, yes, then there is another problem, that is obesity. And the another important thing is that a person who is having obesity, they have a reciprocal increase in the TSH that can happen. That's the many times that we see in the as a subclinical hypothyroidism. So most obese people, and where we do not require treatment for thyroid, but we require treatment for the obesity, that is a weight reduction. So yes, but of course, thyroid is one hormone that has to be kept in mind when you see a person with the excess body weight. Then the other hormone is the cortisol, the steroid hormones. Yes, people are well aware. Many of them will not know the terminology of cortisol, but yes, when we say steroids, yes, people will easily catch it up. Even especially after COVID, they know about steroids. And steroids are another, especially the cortisol is another hormone. When produced in excess amounts in our body, it is usually produced from the adrenal gland, which is located above our kidneys on both sides. So excess cortisol production can result in what is a syndrome called Cushing syndrome, where weight gain or even the edema, these things can happen, and these are the this can be the presentation. Then other hormones linked will be like, yes, there is one, I mean, in pediatric obesity and all, sometimes we see something called leptin related problems. So leptin is another hormone which is related to the obesity. And then other hormone disturbances can happen because of obesity. The other hormone disorder like that, what we see is that low testosterone or a hypogonadism can happen. These are all like reciprocal changes happening because of obesity, not because of the hypogonadism happening obesity, but obesity resulting in the functional hypogonadism. So I think with that, I would stop here with that nutshell about the hormones and the obesity. Over to you,
Yes,
Sean.
sir. Yeah, sir. So thank you, sir. So very nicely, sir told obesity is excess body weight for your height, and there are various methods to identify obesity. And the hormones, if we want to list it, most common is still your excess calorie consumption. Then comes your thyroid hormone, the stress hormone, that is the steroids. And in children, the leptin and other hormones are also there, which are lesser causes. So next, I would like to ask Dr. Vishwanath. So one more thing which we are seeing in common is the PCOS. This is the term which we are hearing from most of the younger females who are eager to conceive. And so, what is PCOS and what is the link between obesity and PCOS?
Yeah, thank you, Sham, for that. And we all might be wondering why is PCOS being talked in endocrine meet. So we have to understand PCOS is definitely as a hormonal disorder, the most common disorder, especially in the women of reproductive age, which will be identified in their adolescence, most of the women. And it is not pretty so uncommon. It is at least estimated that 10 to 12% of the population among women will be suffering from PCOS. And then what is this PCOS? The terminology stands for polycystic ovarian disease or syndrome. And then it is actually a constellation of symptoms wherein the person manifests or comes with symptoms of increased androgen levels in the body. So what are those symptoms? The women most commonly come with irregular cycles, because the moment they miss their cycles, they're worried. So that is what actually brings them to the doctor first. And then the most important thing is irregular cycles. The next important thing that they worry most about is the unwanted bodily hair. Most commonly, it is seen in the upper part of the lip and over the chin part in the male distribution pattern, where it should not be seen for a woman. And the hair, it might be downy color, brownish, or it might be even dark hair thickened when we call it as virilization, which is a severe symptom of PCOS. And having said that, the other thing that they were most worried about, the cosmetic reasons, especially the acne. Acne, especially when they're pus forming acne over the face, be it on the upper chest or the upper back, those are the markers of increased androgen levels in the body. And these are the symptoms that the patient comes with. And once we go ahead and start evaluating them, we find that they have an increased testosterone levels in the body. Testosterone is nothing but a male hormone, which is not supposed to be in the range, higher range in a woman. Once it starts increasing in a woman, it definitely will cause the changes that are not supposed to be seen in a woman. And that are the changes that will be seen in terms of symptoms in a girl or a woman. And why is this androgen levels increasing in them? It is most commonly because of insulin resistance, which we can say as of now. What is this insulin resistance? It is nothing but a state wherein the insulin is there in your body, but it's not able to bring down the effects that the insulin is supposed to bring down. The body senses that the action is not happening. It squeezes more and more insulin from the pancreas. The patient will end up having more amount of insulin in the body, but this higher levels of insulin will go and act on the undesirable or the unusual sites in the body, especially the ovary. The ovaries, once they are exposed to increased insulin levels, they will start secreting more and more of androgens. That is why they end up with having higher androgen levels in the body. Now, what is the main reason for this insulin resistance? Is definitely one of the most important factor is your weight gain. As we can see in our clinics, most of the women who come with PCOS are either overweight or obese. And this is the most important reason for the insulin resistance. Although we might come across lean PCOS where the women are thin but still have PCOS, among them as well, there is a lot of insulin resistance that is playing the disease component as well. So these PCOS and obesity are definitely interlinked. We can't just address one disease or a one factor at a time. We'll have to hit both the diseases together to have a desirable effect that is a normal health of a women. And in turn, a loss of exercise, the loss of exercise will definitely lead to increase in the weight gain. And the lifestyle changes is the most important thing that has to be stressed in every adolescent women of this era, wherein they're more indoors, more social media exposure, where they're moving less, but they're eating more. And even the television or be it the media is full of advertisement, which will make you to start craving for unusual things at unusual time in the middle of the night as well. So in this era, definitely obesity, like Sir Prem Sir said, is causing a lot of trouble. Address the obesity, address the overweight. Definitely, the insulin resistance will come down, whereby we can actually help in bringing down the androgen levels in the body. That is through lifestyle. There are definitely medications for that, and which will help in bringing down the androgen levels. And PCOS should not be taken lightly. At the same time, it should not be worried more about. A woman with PCOS, if treated at the right time, will definitely lead a healthy and fruitful life. It will not cause any much problem with respect to fertility as well, unless until they are taking it seriously and addressing the issue. So this is how our PCOS and obesity are usually linked together.
Yeah. Very nicely put, Dr. Vishwanath. So so increased weight means your insulin is not able to act the way it is supposed to act. So the body increases the insulin levels, and that goes and acts on the ovaries, and there is increased male sex hormone in a female, and that is leading to your irregular cycles or the abnormal hair in a female. So these are all the consequences or the interrelationship between obesity and PCOS. Very nicely explained. Thank you, Dr. Vishwanath. Now, coming to Madam Maithili ma'am, I wanted to know. So we are talking today about thyroid as well. So is thyroid, PCOS, and obesity interlinked? And so, what is the relation between these?
Thank you, Dr. Sham. So, as you rightly said, obesity, thyroid disorders, PCOS are all very common in women. So young women now really are fighting the battle of all these three together. So as Dr. Prem mentioned and then Vishnath mentioned, 10 to 15% of women have these problems, whether it is thyroid disorders, whether it is PCOS or obesity. And then sometimes a woman may have all the three together. She must be putting on weight, she is hypothyroid, and then she may also have a coexisting PCOS. So now how do we differentiate all this? Now the thing is, PCOS symptoms, as has been just described by Dr. Vishwanath. So he said women have menstrual irregularity, women have weight gain, then women have infertility issues, they may have miscarriage, they may have difficulty in conceiving, and then skin problems. So he mentioned about hirsutism, acne, unwanted hair, and then of course, a good number of women have hair fall. All these symptoms of PCOS are present even in women who have a thyroid disorder like hypothyroidism. So the symptoms of both PCOS and hypothyroidism are very, very similar. Then weight gain again is observed in both hypothyroidism as well as PCOS. So all this we really don't know where is the link. There is a bidirectional, multi-directional link between all the three: PCOS, obesity, and hypothyroidism. Then women also have psychosocial issues. This is all because they have some cosmetic concerns regarding their skin, hair, and then unwanted hair, acne, so hair fall. So because of this, they tend to get psychosocial issues like most commonly depression. So women with PCOS and hypothyroidism do have, some negative body image. They may have psychosocial issues. Then they, of course, they have reproductive issues. Then they may have weight gain. So all these they go together so closely. And that is the reason today when we label a woman as PCOS, we first exclude hypothyroidism. So common disorder, thyroid disorder is hypothyroidism. So first we exclude hypothyroidism, we treat hypothyroidism effectively, and then if the women still have all these problems, we say probably she even has PCOS. So hypothyroidism is a great mimicker of the symptoms of polycystic ovarian syndrome.
Yeah, thank you, ma'am. Thank you for putting it in a very nice nutshell so that everyone can understand. So again, the confusion lies. So whether it is the obesity which is causing hypothyroidism, or is it the thyroid which is causing the obesity and PCOS? So chicken came first or the egg came first? Such a scenario is there. So I want to know, Dr. Vishwanath, can you just enlighten us? So just as Madam has already given us a hint that PCOS and hypothyroidism, they do have an overlap. So if we want to just further throw some light on what is the interaction between these things and what came first, how to identify it, any ideas?
It's really difficult to pinpoint and say which came first and which came next. But rest ensured all the three are definitely contributing the same to the same pathology. And as we know that when a person is having an imbalance in their thyroid functions, especially what we call it as thyroid hormones, are the hormones that are released to the blood circulation from your gland, that is a butterfly-shaped gland, which is there in front of your trachea in the anterior part of the neck. So for that gland to function normally, there is something called as TSH hormone, which is the master hormone which comes from the pituitary gland. So that comes and whips your thyroid gland, saying that release hormone to the blood circulation, and then the blood circulation will, and then the hormones will be spilled onto the blood circulation. So what is the function of these thyroid hormones? They actually are required for the normal functioning of each and every cell in the body, starting from the hair follicle till the tip of your finger nail. Each and every cell will definitely require adequate thyroid hormone for the functioning. The most important function of these hormones is with respect to the energy balance in your body, the fat metabolism in the body. So these are the two important factors which will ultimately culminate or contribute to the origin of your obesity and also to certain extent your PCOS pathophysiology. And once there is deficiency of these hormones, meaning the hormones that are to be released into the blood circulation are not adequate. So that is nothing but what we call as hypo meaningless, hypothyroidism. So the gland is not functioning properly, is not leaving the adequate amount of hormones that is required for the normal functioning of your body. So definitely the energy balance, which is supposed to be maintained at a level, is being going into the towards the positive energy balance. And therein there is increase in weight gain. Like Prem sir said, there is certain amount of weight gain because of the fluid retention, which is more commonly seen in the legs as well as your face, which is a loose skin connective tissue over there. That is where it gets goes and accumulates over there. And the remaining part is nothing but the fat mass which is being accumulated in the body. The fat mass is an abnormal fat accumulation, most commonly in your abdominal compartment. And that is what is again going to contribute for the insulin resistance, as I said previously. So the insulin resistance, obesity, again will be seen in a patient who has low thyroid hormone levels in the blood circulation. Once that is there, again, you're giving an invitation for PCOS. So that is how your thyroid hormone is indirectly linked to your PCOS. And for the obesity, like I said, there is reduction in the energy metabolism in the body. All the functions in your body will be slowed, starting from the thought process to the heartbeat, including your respiration, beating of the heart, everything, and the energy expenditure, everything will be slowed. So there is a lot of energy that is conserved, which will be indirectly being accumulated as fat. And that is what is the reason for obesity, along with fluid accumulation. And that is how your thyroid hormones, hypothyroidism especially, is linked to your PCOS. Nonetheless, even patients with hyperthyroidism also will have an imbalance in their cycle irregularities, and that is also is seen. And another reason why hypothyroidism patients will have cycle irregularities is because once your thyroid gland, which is there in front of your neck, is not functioning properly, like I said, the master hormone which is coming from the pituitary will be increased. It is not only that the TSH that is increased, it also increases the prolactin hormone, which is seen in that hypothyroidism. This increased prolactin levels will again act causing a PCOS disease as well. So this is how your PCOS and your thyroid diseases are interlinked, and also how your obesity, PCOS, and thyroid, all of these three form a vicious cycle. So if you want to get out of that, treat all the diseases. First, treat the hypothyroidism if the patient has it, then go for a healthy lifestyle to lose the obesity, and also which will be reflected in PCOS. And if required, definitely endocrine consultation with medical therapy also is helpful for such patients.
Yeah, very nicely summarized. So basically, what we understand till now is obesity is a common problem, the hypothyroidism is a common problem, and PCOS is also quite common. And the three might be interlinked, and it is not as simple as it looks at the outset. There is a lot of intricate hormonal activities going on in our body. Each one has an impact on the other organ as well. So if someone has an issue with the thyroid and is been having weight gain, and also there is irregular cycles, yes, there might be some common underlying factor as well, and which needs to be identified and treated by the specialist doctor. So next, ma'am, my question to you is: commonly we see people like a middle-aged female comes, or a middle-aged male comes with a weight of around 80 to 90 kgs, and the sedentary lifestyle being a part of their lifestyle, and they tell that after joining work and more of sedentary lifestyle, they have gained weight of around 10 to 15 kgs over the past 5 years or so. And when they go and get a test, they find a TSH of 6 or maybe 7, and they come to you and they ask you, ma'am, see what this thyroid has done to my body, so please do something to this thyroid. So now how to pinpoint, like, no, this is the weight issue which is related to thyroid, and what is not related to thyroid? How do you convince the patient, and how do you differentiate? I think some of the hints we have got it in the earlier discussion as well. Can you just elaborate so that viewers can be benefited?
Yeah, Dr. Sham, I totally agree with you. anyone putting on any weight, the first thing that is they blame is the thyroid. So they don't blame that they are not exercising or they have some bad food habits or anything or stress or sedentary lifestyle. So the first thing is the thyroid is blamed. And as Dr. Prem mentioned, everyone gets a thyroid function test done. They get their T3, T4, TSH. They read the report thoroughly, right? They will come and tell us this is high, this is low. So it is very difficult for us to convey, it is very important for us to tell them that, look, the thyroid is different, the weight is different. Of course, we do agree there is a link. Both of them we need to handle them together. But then in thyroid disorders, it is not weight alone. See, we have two common thyroid disorders. One is hypothyroidism, the other is hyperthyroidism. So suppose someone is putting on weight, and if they have associated lethargy, they are very sleeping a lot, they have muscle pains, they are tired, they have irregular menstrual cycles. Definitely, we do have to think whether the woman, is having a coexisting hypothyroidism, and we do evaluate accordingly. Similarly, somebody is losing weight, and then they're anxious, they have sweating, they have palpitations. Definitely, we look whether they have any increase in the thyroid hormone production. Probably we definitely evaluate for hypothyroidism. So weight issues along with other manifestations are common symptoms in women who have thyroid disorders. We are not disputing that. But then every woman putting on weight, then doing the TSH, and then that slight increase in the TSH is responsible for weight gain. Absolutely, this is wrong. So this is a message which I think we need to convey, that it is in fact the other way around. So, some people putting on weight, the TSH may slightly increase. So that is the answer we need to tell them. So all obese people do not have thyroid disease. So we tell them obesity is different, hypothyroidism is different. So that is, both are distinct entities. We need to emphasize on lifestyle modification for weight reduction. And then, of course, if they need a thyroid medication, we will definitely add. And sometimes we see clinicians adding thyroxine medicine. Simply, these are the days where even without reports, even without a lab report of a TSH, they are sometimes, because they are putting on weight, a thyroxine medicine is prescribed. And then these people don't lose weight with the thyroid medicine, so they are unhappy. So they then come to the endocrinologist, and then where we reassure them that obesity is different, please change your lifestyle, and then you do not need a thyroid medicine. So this is what I wanted to share, Shyam.
Thank you, ma'am. So yes, so hypothyroidism can lead to obesity, but not all obesities are because of the hypothyroidism, is what madam mentioned to us, and we should all remember it in our future things. So next, Dr. Prem sir, I wanted to know. So there are two patients who are obese, one with a very much elevated TSH, say around 150, and one, like just we discussed earlier, between 7 to 10, and they come to you to seek weight loss. So what can treating hypothyroidism lead to weight loss, and what would be the weight loss in these two set of patients? What should be their expectation from you?
Yes, so we had a lot of discussions around obesity and the weight, the thyroid. Mostly, so as you were telling, a patient with a very high elevated TSH and maybe even a very low T4 levels, a frank hypothyroidism. In those kind of patients, after starting the thyroxine tablet, yes, there will be some sort of weight reduction, but that is not the fat mass that is coming down for that patient. It is a fluid retention which has happened because of the hypothyroidism that is going to go out. Commonly, rather than in adults, what we see is with the children, because children, they come with a frank hypothyroid features, unlike adults, because adults nowadays with lots of labs in and around, they keep on testing the thyroid, and even the TSH has become a routine testing for any lab. because I don't think there is any lab now not doing a TSH. At least they get it done outsourced. They keep a tie-up with some, even if it's a very small lab, they'll keep a tie-up with a bigger lab and get a TSH done. So because it has become such common testing. So adults, we do not usually that much a frank hypothyroid presentation we don't see, but children, yes, we do see. And after starting thyroxine, in a month or so, when they come for the review, parents used to complain, doctor, my kid has lost all the weight he was having. He is now looking, he's looking malnourished now. So
Yes.
that kind of worry will be there. That is actually, I tell them, yes, it was actually the fluid retained, that is the edema for the child which was there, and that has gone now. He is now normal. He was abnormal, now he is normal. But on the other hand side, the other side, which Shyam was mentioning, there is a TSH around 5 to 10 and having an overweight now. In that sort of situation, starting a thyroxine alone is not at all going to bring down the weight to any extent what they think about. Because those are the patients who are always worried about weight. And there, definitely, it is not a thyroxine, but I would tell them, you do not need a thyroxine now. But what you need is a change in your lifestyle. So you have to change your diet and you have to add physical activity. So I tell them 80% is due to your diet and 20% is due to your physical inactivity. So that has to be the one that has to be kept in mind, that has to be practiced. And that change in the body habitus will definitely, if the patient is not having any underlying autoimmune thyroid problem, that weight reduction is definitely bring down his TSH also. So in
Yes.
that sort of situation, do not treat the TSH, but the weight. Thank you,
Yes,
Shyam.
sir. So yeah, sir gave us a wonderful information. Thyroxine is not a weight loss medication. Okay, so it is a hormone. If you are deficient, we replace it. Okay, and the deficiency can lead to weight gain, as sir told. And only if you are deficient in the thyroid hormone, then we have to replace it. It is not a so-called weight loss pill or a magic pill which leads to weight loss. So next, Dr. Vishwanath, now we discussed about the PCOS and thyroid being interlinked and both mimicking each other. So suppose some female coming with irregular cycles and a hypothyroidism. We have detected a hypothyroidism. So does the treatment of hypothyroidism alone lead to the reduction of the symptoms of PCOS, and how does it benefit them?
Like I said, PCOS and hypothyroidism are very intricately linked, and they contribute to each other in a very complex manner. To be plain and simple, what exactly is happening in PCOS, like I said previously, insulin resistance and overweight. And what is the hypothyroidism, especially when we say the thyroid disorders, it's what we call it as hypothyroidism, the deficiency of the thyroid hormones in the circulation. That will lead to a slowness of your bodily functions, including the resting energy expenditure, as well as even the motivation, lack of motivation to move around as well, also will be reduced. And these in the long term will definitely add on to your positive energy build up in the body and obesity. Dr. Prem sir was what he was saying, that once you treat an adult patient who is coming with the hypothyroidism, in the next 2 to 3 months, you will see at least 1.5 to 3 kg weight loss maximum you can see with that after 3 to 4 months or probably 6 months. But what was that weight loss was definitely being contributed by the fluid retention that was there. And that is why you're seeing such a wonderful response in a short term. But in the longer duration, the bodily functions which are affected, which was slowed down, will come down to normal. The person who was moving less will start moving more. And that is how your obesity will be slowly improved over a longer duration of time. And we can't say that it is just because of the thyroxine hormone that we are giving. No, we have made the patient euthyroid. Euthyroid meaning we brought the patient from hypothyroid to the normal state. Now he is able to function normally, and that is how he is able to move around more and do his activities more, and the energy expenditure also will come down to the normal level. And that is how you can address the obesity or as the weight gain that was there, which was because of the pathology, not directly but at least indirectly related to your thyroid disease. And that is how a patient loses weight. And once the person loses weight, the insulin resistance factor also improves. That is what is the main important problem that we had seen in a patient with PCOS. And in an untreated patient, who has both hypothyroidism and PCOS, the prolactin hormone, which is coming from the pituitary, also will be high in an untreated patient with hypothyroidism. And in fact, just hypothyroidism also will give a picture of PCOD in the ultrasound. So that is more medical, the terminologies. But to be more simple, the prolactin hormone is reduced by treating the hypothyroidism state to the normal state. When we bring the prolactin decreases, and that was which was contributing to the PCOS factor is also brought into normal levels, and thereby the PCOS improves. The prolactin is addressed, the insulin resistance is addressed indirectly by bringing down the insulin resistance factor, which was there because of obesity. Definitely, by addressing hypothyroidism, we are at least moving in the direction of treating a patient who has PCOS, and the factors which are responsible will be taken care by treating hypothyroidism. Nonetheless, few patients will still remain having symptoms despite treating hypothyroidism. And for that, we have to go for aggressive lifestyle modification and, if required, medical therapy.
Yes, thank you. Thank you, Vishnu. So I think it is very clear that if you have hypothyroidism and irregular cycles, then yes, correction of your thyroid state will improve some of the symptoms, and sometimes even the infertility also improves, and everything is normal with just a single pill. And again, that miraculous pill has to be taken under the guidance of the doctor as well. So next, Dr. Prem, sir, what patients commonly ask is, sir, any specific diet, okay, for the thyroid-related problems, or any specific exercises? Some people say that I do my neck exercise and everything is okay, my thyroid is improving. So can you just throw some light on this diet and exercise with respect to thyroid and to certain extent obesity?
Yes, thank you, Sham, again. So as far as diet, first aspect, diet and the thyroid. So this is the one where the YouTubers live on. So many vloggers and where many health coaches who get a lot of views on this diet and the thyroid. So scientifically, let us see the facts. So the first fact is that many people think that people with having thyroid disorder, not a normal thyroid, but having a thyroid disorder, they should not take a cabbage and cauliflower is what is there in people's mind, which is now, these are all very well established matter, and very hard to take it out also. So the fact is that yes, goitrogens can disturb the thyroid function, but this is the one that you have to keep in mind, people who are listening, but it is only when it is taken in very large quantity. Say, for example, a person who is taking more than 1 kilogram of cabbage or cauliflower for more than 20 years daily, continuously, that is when there is a possibility of change in the thyroid function due to the goitrogens. Otherwise, it is not going to bring any effect. What quantities that we take, the gobi or the Bangalore gobi Manchurian, why should you miss it? Because of the saying that you are having a thyroid dysfunction. No, you need not. And another fact is that these goitrogens are destroyed, especially when it is properly cooked. So many people ask me, doctor, then can we take the cabbage which is put in the salad? No problem, because you are going to take how much salad you are going to take, that too once in a while. People are always hesitant in taking vegetable salads, isn't it? So the small quantities that you are taking is not going to change your thyroid function. And second thing about the diet is that people think that they should not take any soya product at all. But no, it is not like that. Soya product should not be consumed along with the thyroid tablet, because yes, thyroid tablet has to be taken in an empty stomach, usually in the morning. And after 1 hour, say 1 hour is advised, at least 30 to 45 minutes we have to elapse time before taking any other food or water. That's the only thing. So taking a soya product in the evening or night is not going to change your thyroid hormones functioning. Then the second aspect, then third aspect, sorry, I missed it, the salt. Many people take that whether they should stop using iodized salt. No, people are coming with pink salt advertisements and all, And now advertisement, I don't know. I think I've seen that it is good for thyroid. Some salt advertisement, I think I saw. So there is nothing like that. Salt using salt in a very limited amount is always good for our general health, I can say. But there is nothing special for the thyroid. Then exercise aspect. Is there an exercise? Neck exercises. We see a lot of yogas for the thyroid. People do ask, if I do that, if the thyroid function will improve. Dear friends, there is no exercise which is going to improve or increase your thyroid hormone production. If it is definitely we will be the first people to enhance you exercise, because we are people who make we are doctors who make people work to reduce their weight. So definitely we will give you exercise for the thyroid also if it is there. But sorry, unfortunately, we do not have any sort of exercises which is going to improve your thyroid function. Yes, a general exercise is not going to improve your body or even might help in reducing your body weight. But the thyroid hormone disorders that we see commonly in our present days, it is an autoimmune problem, and it is an entirely different entity. It is not because of your lack of exercise. So please keep these things in your mind when you are if you are having any thyroid problem. Thank you, Shyam.
Thank you, sir. Thank you very much. So I think the common misconceptions you have addressed very nicely. So all of us remember, you can eat cabbage, cauliflower, broccoli, whatever you want, and you can eat soya and all the products. So there is no specific thing that you should not eat for the thyroid per se. And yes, for obesity, the diet plan is different. So, and as far as exercise is concerned, general exercises are good enough, which will help you to lose weight. So next, Dr. Maithili ma'am, I just wanted to know, sometimes it so happens people don't know whom to consult. Okay, so they would have visited a number of doctors. Okay, so like what are the key issues with weight or the hormonal issues which you want to tell our viewers, like if they are suffering or anyone of their friends or relatives are having these issues, then they are the people who should consult the endocrinologist.
Yeah, Dr. Sham, this is a very good question. So, what we should remember is that obesity by itself is a disease. 90% of cases, it is exogenous obesity. It is related to your food, your lifestyle, your bad lifestyle. And then it is usually not an endocrine disease. So it is usually non-hormonal. It is either due to your diet, sedentary lifestyle, your stress, your lack of exercise. The present, lifestyle is responsible for obesity. And then second comes drugs. So drugs are very common cause of obesity, which we always have to look into. So majority of the times, obesity is a non-hormonal disorder. But however, people come and ask us, I am putting on weight, please test my hormones. So it is always not necessary that everyone should have a hormonal test done. So there are some clues in somebody putting on weight that this is an endocrine cause. This is probably needs an endocrine workup. So for example, you see, let us start with a child. So today, childhood obesity is so common that majority of parents are concerned, and then they are brought to the endocrinologist for, testing for hormonal evaluation. So if the child is obese, look at their height. If they're growing normally, so good height, good, weight is more, that tells us that this is not endocrine. That tells us that this is exogenous obesity related to the bad lifestyle. So if there is a child who is very short, not growing, putting on weight, very poor scholastic performance, and then there are some other issues like muscle weakness, pains, etc., that is where we need an endocrine workup. So in children, look for short stature, look for any muscle weakness, which are pointers towards an endocrine disease. Now, coming to women in the reproductive age group, again, we have already discussed that presence of menstrual irregularities, presence of unwanted hair in an obese adolescent young woman, that tells us that she needs a workup for an endocrine cause. Then finally, if adults, if you take, sometimes some people they come with weight loss. So if there is a severe weight loss, again, they are again referred to the endocrinologist. We look whether really they have an endocrine disease or not. So history, like, for diabetes, polyuria, polydipsia, unwanted thirst, and then excess of urination, these are some symptoms. And so are thyroid disorders, adrenal disorders. They do have some pointers to say that this is probably an endocrine cause. So look for any proximal muscle weakness. They have difficulty in getting up, myalgias. Again, some endocrine diseases are responsible. Then uncontrolled diabetes, hypertension. And then if they're very obese, that is where we need an endocrine doctor. So always look for pointers in obese people, which will give a clue that this is probably an endocrine disorder, and then they need further work. So not all obese people, we definitely look for whether they have comorbidities like glucose intolerance, whether they have any fatty liver, whether or they have hypertension, lipid abnormalities. These are the tests which we routinely do. A hormonal workup is required in certain cases. Then most important is rule out drugs. Majority of the times we see obese people using corticosteroids for either a dermatology disorder or a rheumatological illness. They just go on taking those medicines, and sometimes psychiatric illness, they do take some psychotropic medication. So these are all some causes of obesity. So look for drugs, take a good history of their diet and their lifestyle, and then do an endocrine workup wherever necessary.
Thank you. Thank you for summarizing it very nicely, ma'am. So not all obesity is thyroid or hormone related. There are certain factors like, your sudden increase, or you're not able to, your energy levels are low, or you're not able to get up from your chair, and certain other factors which your primary treating doctor might recognize, and they will help you to consult an endocrinologist, and you can get the right treatment from that perspective. So I think with this, we'll conclude the session. And before concluding, I would like to request all of our panelists to give closing remarks. So starting from Vishwanath, your closing remarks, please. What is the key take-home message which you would give to our audience?
The most common disease or syndrome, that is PCOS syndrome, which people worry more about. It is a disease that is not to be worried, but has to be taken seriously, meaning you have to take action rather than just worrying about it. And suppose the patient has 2 or 3 comorbidities like, hypothyroidism, or diagnosed with PCOS and obesity. It is not just taking medications or for the PCOS part, or just taking the pill for the thyroid disease. It is not a rainbow pill. It is just a pill which is just going to address your hypothyroidism. Nonetheless, you will have to take multidisciplinary action, or you have to do a multi-pronged attack on the diseases in the way by doing lifestyle changes, the therapy, if at all it is required. So I think this is what I'd like to summarize about these 3 important, most common diseases that we can see nowadays.
Yeah, thank you. Sir, Dr. Prem, sir, one
Yes.
catchy, what is the take-home messages which you would like to give? Yeah.
So my take-home, yes, Vishwanath has already put it up. So I will add it up to, like, my take-home message will be TISS, TISS, treat thyroid, treat it simple, but not silly. Thank you.
Yeah, very nice, very nice. Thank you, sir. Ma'am, your closing remarks and take-home message for our audience.
Thank you, Shyam. The thing is, today tests are accessible. Disorders have become common. So there is a lot of panic with these disorders and then unnecessary testing, which is really not needed. I think a healthy lifestyle is important. For thyroid disorders, don't unnecessarily treat adequately wherever required. Then for PCOS, there is an unnecessary, fear and a rush towards diagnosis of PCOS, which is really not necessary in young women.
Yeah, thank you, ma'am. So thank you for wonderfully summarizing the today's take-home messages. So with this, I think we'll conclude the session, and I thank all of you for taking time out of your busy schedule and contributing to create the awareness among common people. And definitely, we will have to strive more and more to create the awareness in this era of social media, where the number of endocrinologists are very less compared to the health bloggers. So we will have to strive hard to provide the right information and scientific information. So I request all the viewers to spread this message, and if in doubt, always consult the hormone specialist, that is the endocrinologist. Don't make decision based on the Google algorithms or the Chat GPT algorithms or your vloggers' suggestions. So always consult an endocrinologist. We are always here to help you to clear our doubts, to clear your doubts, and we are not there just there to give you a pill. In fact, we most of our patients during our consultation, most of the time is spent in educating the patients so that they spread the message to others. So if at all, if you have any doubts, any point of time, always consult your nearby endocrinologist, and they will help you to solve your issues. So with this, I would like to conclude this session, and I thank the Indian Thyroid Society and the organizing team, and special thanks to Dr. Mohan Shenoy sir for giving us this wonderful opportunity. And thank you all. And I conclude this session. Thank you.
Thank you.
Thank you, Sham. Excellent
Thank you.
coordination.
Thank you,
Thank you so
Sham.
much.